everyone, I'm Joanna Quilty, CEO of the New South Wales Council of Social Service, and I'm joined today by Dr. Fiona Kotvojs, who is the Liberal candidate for the seat of Bega in the upcoming state by-election. Thanks, Fiona, for joining with us today. We've sent through some questions and we'll get straight into them if it's okay with you.
That's fine.
Housing costs, as you know, in the Bega electorate, but right across regional New South Wales, are skyrocketing. Homelessness is on the rise. Our homelessness services can't cope with demand, and there's just not enough social housing. So what are the Liberal Party's plans to address this quite dire situation?
So last year there was the independent task force on regional housing, and that looked at housing across the broad spectrum. That was done by the state government, and that was released in November along with a range of recommendations. So some of those recommendations have now already started to be implemented. In addition, the councils across this electorate are doing work. So Bega Council, for example, has a study out at the moment for community consultation. Eurobodalla Council put in a submission to the state government's independent task force. Those are quite good documents, and they look at three levels. They look at the refuges, and so certainly from my perspective, there are three levels. There's the refuges, there's the social housing, and then there is getting affordable housing for both renting and purchase, and they're all interlinked but independent. And so specifically in terms of homelessness, what we need to do is address all three of those aspects. There are some really interesting things that we can do in the short term, none of which will actually resolve it tomorrow, but we need to start doing some of those now. And we should be able to increase the housing supply for the social housing and for those areas, that end of it, quite quickly. The announcement this week of funding to support areas that are being developed should reduce the prices of new developments as well. But there's a whole range of things that we need to do, really across the spectrum. So, for example, building accommodation when we're building a new hospital up at Eurobodalla, looking at different strategies at a federal government level and working at the federal government to promote, I guess, more housing for people as against just holiday housing and things going out into Airbnb, which is causing a problem. All those sorts of things. But it is a diversity. It's not just one solution.
Absolutely. During COVID, we've certainly seen the social services sector really step it up to support the most vulnerable in our communities and keep them safe and well. But we know that the sector is stretched to capacity and it's having real trouble recruiting and retaining staff, largely because of poor pay and conditions. So how will you champion the work of the sector, including that of local First Nations organisations, and ensure that it gets the resources and the recognition that it needs?
So I guess I've already been working for some years in different contexts with all of the local Aboriginal local land councils across the electorate, from a range of different hats, not my political hat. I've met several times over the last couple of years with Katungal about their work, and I've also worked with a number of Aboriginal leaders across the area for several years. So for me, a large part of it is actually making sure that we have good communication, good relationships, and identify exactly what the issues are and what support is required, so that it is a bottom-up focus rather than a top-down. And I work in international development. It's what I do as my core business, and I design and evaluate programs in an international development context. So from that, I'm very conscious that organisations, the support and the programs and what you do bottom up is much better, and the only way to go. So I guess that's part of it. And then once you know exactly what needs to be done and what the requirements are, then you can look at appropriate levels of resourcing.
Thank you for that. We're seeing women continuing to suffer greater impacts from COVID, including increased caring responsibilities, greater job losses, and impacts from things like rising domestic violence. What will you do to advocate for better support for women and children in the electorate and to address the issue of rising domestic violence?
This is a really difficult issue, and it's an incredibly tragic issue as well, because we end up in cycles where both poverty cycles more broadly, but also the cycles of domestic violence. And it's really important that we address it and we resolve it. And we help people break out of that cycle. We need to make sure that we have a range of places where people can go who need to escape from domestic violence. At the present moment, we don't have enough safe places for women and for children to go to. So I will advocate and support strategies to increase the number of beds and the number of spaces that are really available for women and children in particular. We need to look at how the family court works so that it is less, perhaps I should say less adversarial, because in many cases it actually exacerbates the problems and the conflict between parties rather than reducing it. And it makes situations in many cases much worse. So we need to look at that as well. We need to look at the pay rates for women in various areas in terms of economic security. So early childhood teachers, for example, and aged care workers are perhaps two of the most critical workers in our society, and they're also amongst the lowest paid in our society. And I think the failure to recognise what they do and the importance and the significance of what they do in our society is a major challenge. I'm just going to make a noise because I need to wind my window up because the rain's coming in. There we go. So that's a really major challenge. But I would also say I think one of the most critical things is actually talking to the groups that are involved. I've already met with several of the major players in terms of social housing across the electorate and in terms of domestic violence. I support particular women who are going through those issues and going through the court system at the moment. But it's very important that the issues that they identify and that those organisations identify are the ones, and their priorities are what we address first, rather than what people who are not involved in it at the coalface may believe are the most critical issues.
So it may not surprise you, but I think it does surprise some that there's such a large proportion of children growing up in poverty in the electorate. And we know that this places them at greater risk of abuse, neglect and poorer educational outcomes. So what are your party's policies to support parents and promote children's wellbeing?
I have to say I haven't looked at the party's policies. I didn't see the questions until quite literally 5 minutes before the interview. So I do apologise for that. But from my perspective, I believe what we need to do is to ensure that all children have access to what is required. So free education is critical, that the support provided to families is adequate to ensure that their needs are met. And so family support and things like that is really important. The difficulty we have in many cases is how do you keep children safe from harm? Because it's quite, in many cases, it is quite difficult to do that without intervening directly in families. You know, my dad says it's very easy to become a parent, but he feels that all parents should actually have to have a license before they can become a parent. You know, we do if we want to be a driver. And being a parent is actually the most important and the most significant career anybody will ever have in their life. So I would really like to see more training and more skills development for people so they understand. There are a lot of people out there that I come across, particularly when I was lifeline training, who actually haven't had good role models in their own life and therefore don't necessarily know what being good parenting skills are. So there are some things that we can do there, but there's a whole range of things we need to do. And it's not just providing more money. It's safe housing, it's providing people with the skills, it's making sure that children have places that they can go to if they need to escape, if they need to get support, if they need to get advice. Youthline was really good. I mean, we spoke to lots of children when I was working on Youthline and helped them work through what their strategies would be in their situation.
I want to now turn to the issue of emergency responses. The research tells us that they can suffer from a lack of local knowledge, either too much too soon or too little too late. What do you think are the key issues in developing disaster preparedness and emergency response systems that actually work on the ground?
So I've been a director with Oxfam for 9 years. I work in international development and in international disaster responses. I've evaluated a huge range of disasters overseas and the response to them. I was involved in the bushfires here, both as somebody where it went through our farm, but also through the RFS, and then also helping support a number of people in the Cobargo region, which is my home area, and sort of through to Nerigunda and Bemboka areas through that process. What we need to do is adopt many of the strategies that we have in international development. So we have to have better planning to start with. We need to know which agency is going to do what. You know, before we have a disaster in any agency goes into something in Fiji or Samoa or anywhere overseas, every international agency knows what they're going to do. We don't have that situation in Australia. So when the bushfires came, you had a whole range of different community-based organisations and NGOs coming in and doing things, but they were kind of falling over each other because they hadn't planned who was going to do what at the same time. We also need to educate the public because there was a huge demand for all the money that had been collected by organisations to be spent now, immediately. And we know that for many people, that is just not a good strategy. It's 2 years on after the fires, and it's only now that a lot of people are saying that they need support and they're coming out and recognising that need. So we need to ensure that organisations and the public recognises this is a long-term process, not just something that's a quick fix and then gone. And quite often, if you pump lots of money in at the start, you can actually do more damage than good, or at least it just gets wasted. So it's having that understanding about the balance that there are things you need to do at the start. You need to make sure everybody has food, everybody has water, everybody has shelter. And then over time, there are other areas of support that are required as we progress.
Yeah, so look, related to that, we are seeing more and more disasters, including the current pandemic, floods, bushfires and drought. And we know that they have greater impacts for rural areas, for already disadvantaged groups, and for the mental and physical health of our communities. So specifically in relation to the health system, what do you think needs to happen to ensure that local health services in particular are robust enough to cope with these occurrences?
I think there's a couple of things. So I'm very pleased that we have the new level 4 hospital being built in Eurobodalla. That will really improve our health capacity in this area. And then having the 2 level 4 hospitals, both Bega and Eurobodalla, will then sort of multiply those effects because you've got, we'll end up with more specialists and things in the area, which is important. However, I also believe that what we need to do is have a real focus on prevention. So we need more health services that are focusing on how do we build greater resilience into the health of individuals, into the mental health of individuals, because a lot of the issues in terms of disasters are not just the physical, that tends to be the smaller part. It's really the mental health issues that are more critical and more long-term. So we need to work at developing more strength amongst community-based organisations, more strength amongst in our health services in terms of mental health. Things like Head Start are great. They deal with younger people, but we don't necessarily have that strength for older people. Men's sheds are a really good thing for men in terms of mental health and responding. So our health system needs to look broader than just thinking hospitals, doctors, and that's part of it, but we need to look at how we can use the range of different organisations across the area to build their capacity so that we can all support a proactive approach and a preventative approach to health rather than just a reactive situation when there is some disaster.
Thank you, Fiona. That's in fact all of the questions that we have for you, but we do really appreciate you finding time for us in amongst your busy schedule to cover off on these important issues and to give us your perspective. And we want to wish you all the best in the by-election on the 12th of February.
Thanks very much.